Hi. Hi, welcome. Just want to welcome everybody. My name's Dr. Michael Papa. My name's Dr. Michael Papa. I've been in practice here in Jupiter, Florida, as well as Palm Beach Gardens for approximately 30 years. Just want to introduce myself. We've got about between three offices in Gardens, Port St. Lucie, and here. We have about a 10,000 patient base. Just want to go through a few things. We're going through a little crisis here. However you feel about the coronavirus or what's going on with people, it's not a good thing. And hopefully we, as Americans and the world, turn this into something that is good. So what I'm going to do and what I'm going to offer to you, if you're a patient or not a patient right now, is we're famous for playing defense rather than offense. So the number one thing, or one of the number one things for the to fighting this coronavirus is a couple things. One is, everybody see me? I'm trying to find out, make sure I'm on here. Okay, hopefully I'm on. If not, my assistant will text me and let me know. So all I'd like to do is let everybody know that, we are live right now. This is the second time we've done this. First time we kind of made a mistake. So what we're going to be doing here is we're going to talk a little bit. Let's start playing offense. Whether it's the cold, whether it's the flu, whether it's some sort of disease, stop sitting back, waiting to watch the news and have them tell you what you should do or what you shouldn't do. To me, that's not the way to play. We want to have a offensive approach. I've run a wellness practice here for a long time, and we teach our patients how to be healthy, how to stay healthy, and how to continue to live a healthy, prosperous, positive lifestyle. And that's one of the number one things. You want to be proactive. You don't want to be a victim to this disease. You want to do the things you need to do. So what's the best defense for you to fight the coronavirus? Well, you're listening to the defensive stuff about wash your hands and wear a mask and avoid people 6 feet, 6 feet, 6 feet. Great. Well, what's the offense, guys? What's our offensive approach? Well, I think our offensive approach should be a couple things. One, it should be live a healthy lifestyle. Stay structured. You're sitting home now and you're saying to yourself, well, I'm watching TV, I'm sleeping in, I'm not eating healthy. Well, there are certain things that we want to do to maintain a healthy lifestyle. And first is you have to have some self-discipline. To sit home and not do anything and not be on a schedule just because you're not doing what you need to do, it's not the best thing. Structure is important. What I tell my patients, if you don't change something in your life right now, whether it's lose weight, eat healthier, exercise more, sleep less, be more productive, where are you going to be in a year or 5 years? One of the number one offensive right now for this disease, this virus, and any virus that you're going to be coming across for the rest of your life, because guess what? Coronavirus, they may lift that quarantine, but it's still there. It's not going anywhere. In 3 months, it's there. In 6 months, it's there. As well as the flu and other diseases that are potential health risks to everybody. So we're going to talk about a few things. One is you want to set your goals. Where do you want to be a week from now? Where do you want to be 6 weeks from now? Where do you want to be 1 year from now with you as a healthy person? Or do you need to be healthier? How many out there right now are saying, well, I eat great every day, all day? I guarantee you, everybody out there, if you honestly look at yourself and say, hey, I can eat a little bit better. I can do a little bit more for myself. I can exercise a little bit more. I can do it. But until you write it down and you plan it and you structure it, it's not a real goal. If you set a goal and you put a timetable to that goal, then you're going to stay healthy. You need to maintain a regimen. When you go on vacation and you say, well, you know what? I'm on vacation. I'll have that extra potato. I'll have the chips. I'll have another cocktail because I'm on vacation. So next week when I get back from my vacation, then I'll start up on my exercise and my program again. Same thing around New Year's. Well, after New Year's, it's the holidays. I'll do this. Well, guess what? We're in the coronavirus right now. We may be quarantined for 4 weeks, 6 weeks, 8 weeks, 18 months, some doctors said, which I think is total insanity from my perspective. Everybody's got to help everybody else stay healthy and maintain healthy. We're gonna hit some points today that are gonna help you help yourselves. But if I don't get the main point of your health is one person's responsible for it, and that's you. Don't look to the media. Don't look to the politicians. Don't even look to your doctor. You need to take care of yourself on a daily basis. I guarantee if you're sitting there at home right now at your kitchen table or sitting in bed or on the couch watching something, and you have something in your hand right now, and I don't care if it's an apple, I don't care if it's an orange, I don't care if it's a Dorito, I don't care if it's a glass of vodka, you have that sitting in your hand right now, and you're going to say, you know what? I know if that's healthy or not. I know if that's good for me or not good for me. I know if I should eat it or I shouldn't eat it. Well, guess what? It's your choice. There's plenty of education out there. If you're watching this, you have access to Google, you have access to YouTube, you have access to so much educational information. Rather than sitting there and watching these brain cell sucking videos on Instagram and other videos, even though some of them make you laugh, but be productive. Educate yourself right now. If you're stuck at home, do stuff that has a positive influence on your brain. Watching that news over and over and over again with them saying the same thing every half hour, this isn't a TV sitcom. This isn't a documentary drama where you tune in tomorrow and they're going to solve the mystery. Guess what? This is a sickness. This is something that you got to prepare yourself. The best preparation that you can have, the best offense you can have is getting off your butt and doing something. Don't talk about it. Don't sit there and complain and complain and complain. Do something about it. Action. Put your attitude, put your emotion, and get up, write some goals. Things you complain about, fix them. Stop complaining about it. Stop sitting there and just saying, well, I should do this or do this. Because you set an example for yourself. I set an example for my patients. I set an example for the people around me, my kids, my friends, my colleagues, my staff. You can't preach and not practice. There's a couple of things, we're going to give you some tips, like I said, but complaining gets you nowhere. What does complaining do? Watching these news things and complaining, and hey, guilty sometimes too, and you got to catch yourself about complaining. Complaining gives you a negative attitude, sets fatigue. Fatigue sets depression. Depression sets sedentary lifestyle, and a cycle that you continually go in. Because I know people there now that are stuck in their house and they don't want to go out, and it's depressing. You feel like your life has been interrupted. You feel like, wow, what do I do? That's why I'm into the goal setting. Set your goals, redo your resume. Learn another language. Don't just sit there. Have a plan. Because if they say tomorrow, guys, we're going to lift the quarantine April 14th, what do? You go back to work? Is your job going to be there or not going to be there? Should you exercise? Shouldn't you exercise? I think you need to have a plan. Come out of the box running. Don't just sit and say, okay, quarantine, what do I do now? Do it. Should I structure something? Should I do something? It's a key that wellness is important. Wellness is important. Well, let's talk a little bit about wellness, right? Education is knowledge. So the more you know, the more educated you are, the more you search for facts, and don't believe what everybody tells you. Everybody's an individual. So the more you know, the better you're going to be when it comes to your health, your job. Learn more about your job while you're sitting home right now. But overall health, let's talk about a few things that hopefully will give you some ideas. It's an old management tool that, you know, I talk to patients and anybody out there having problems sleeping, right? Insomnia. But in these days here, you watch the news before you go to bed. Big mistake. But this is going to help you sleep a little bit better. But everything I give you has to have structure to it. You have to do it on a regular basis to get the best results. One, before you go to bed at night, get a pad and a pen or a pencil. The younger will do their iPhone or their app pad, or they'll write it up on their WhatsApp and send it to themselves. But this is what you do. Before you go to bed at night, write down everything you have to do tomorrow. You know, and then everybody says to me, hey, you know, what do I have to do tomorrow? You know, same thing I did today, same thing I did that. No, that's the separation. That's the goals. That's what you want to do. You set where you want to lose weight, where you get a better job, where you want to be healthier. You want to set your diet. You structure your day. You start by writing the things you have to do tomorrow. Everything from getting out of bed to working out to going shopping and for food to fixing the lawn to doing chores around the house. If you are working, and things you need to do to work, paying your bills, whatever it is. And then you prioritize them. Get it out of your head, put it on paper. By putting it on paper, it clears the head. So you're not worried about it. It doesn't happen the first night you do it. It's a structure. You do it every day and your body's used to it. Because as soon as you're ready to hit your head, hit that pillow, you can say, oh, I forgot one more thing. And you put it down. Get it out of your head and on paper will allow you to rest better, will allow you to sleep. And then when you wake up in the morning, you know how to start your day. You know the things you need to do. One of the most important things, and we talked about this Saturday on a live with Dr. Colon. Hopefully she's going to join me this Saturday at noon as well. And what you want to do, sleep is extremely important. Structured sleep. You should get 6 to 8 hours sleep per night. And I know people are napping during the day, and I know they're crashing out during a movie they're watching. But if you're stuck at home, you can't. This is not a vacation. This is not time to go and have your cocktails and start, you know, watching movies every day and pigging out. Because guess what? Food right now is not something that is shortage. There's no shortage on food. Good food, healthy food, vegetables, fruit. You know, they're saying farmers now, they can't bring them to the market because they have no access to it. They do the green markets. They have no way, and they can't get rid of their fruits and vegetables. That's an access that you want to have. You know, try to go with, you know, we'll jump right now just to diet aspect. You know, everybody has their own types of diets, but what you put in your body is exactly the results you're going to get out. So a high alkaline diet is the way to go. And people say, what do you mean high? In this time, in sickness, cancer patients, they put on high alkaline diets. Why? Because cancer can't survive an alkaline environment. Well, most viruses can't either. So people say, well, what should I get for, you know, what's an alkaline food, doc? What do I need to do? Simple. Google it. Google it. Alkaline foods, acidic foods. And it's going to give you a list of the highest alkaline foods to the lowest or the more acidic. When you go shopping and you go for your fruits, your vegetables, watermelon is one of the highest alkaline fruits you can get. So you want to stay away from, you know, the alcohols, the sugars, and so forth to help build your immunity. The healthier you are, this is my point from the beginning of this video, the healthier you are, the more your body is going to fight any virus, any flu, any cold. It's not just about corona. It's about your lifestyle. And you're more susceptible to things the less healthy you are. And your diet, definitely your diet's going to be a big factor in that. If you eat good, you feel good. If you eat like crap, that's how you feel. You know how You eat Thanksgiving, and then you wake up the next day, and how do you feel? Bloated, tired, fatigued. Probably that night you feel tired and fatigued. So you can't afford right now, when you have a virus out there that's highly contagious and everybody's vulnerable to it, everybody's body, the healthier you are, the better you're going to fight it. So your energy through the foods you eat is going to help fight it. You go with a lot of antioxidants. And when I was talking to some friends, and we did a little bit on Saturday about type good things to do, is like lemons, your vegetables, ginger, wheatgrass. These things are highly, garlic, as an Italian, of course, you can do garlic, but that'll keep people away from you. If you do a lot of onions and a lot of garlic, you're not going to worry about keeping that 6 feet. They'll keep at least 6 feet from you. So a couple things. You'll get into what they call a REM sleep better. If you don't watch the news, you write things down before you go to bed. It'll allow you to sleep. Don't eat 2 hours before you go to bed at night. That'll allow your food to digest better, because when you go to sleep at night, your heart slows down, your lungs slow down, your digestive system slows down. So it's not going to process the food as it normally would, and it keeps the body awake because the blood is pumping a little bit harder to digest it. So it's a hard discipline to hit, and you got to talk to your kids. You know, homeschool or not, that's difficult, because trapped with 5 in a house or 6 in a house or 7 in a house, if they're adults, it drives you crazy. With kids, you know, they want to be entertained. They have every aspect in the world, but they want to be entertained, which does what? Increases everybody's stress level. So everything I'm going through with you, setting goals, seeing what you want to do, have your children do it too. And I'm talking kids up to 5 years old. They'll write it out. They'll have fun with it. But that's going to keep everybody with some sanity. Okay? Let's talk about a few other things. People don't plan to fail. They fail to plan. So in today's talk, that's one of the number one things. I'm going to ask you a question right now, and I'm going to ask, how many glasses of water have you had today? The number one thing that's going to increase your body's ability to stay healthy is the food and the water. You should be drinking water throughout the day. Water, H2O, not Kool-Aid, not soda, not beer, H2O, water. You should be drinking that throughout the day. That helps flush out the toxins. That helps increase the immunity of your body. Your body's made up of 78% water, 93% water. Pick your source. Different opinions, different people have different opinions of how much your body's made up of water. Doesn't matter to me, because water is the number one thing that helps detoxify you. Living here in beautiful Florida, you know, today it's hot. It's almost 90 degrees out there. You're dehydrating. You're losing constant fluids. So you want to definitely increase your water intake. You should be drinking 6 to 8 glasses. You know, the real formula for this is you want to take your body weight. Say you weigh 150 pounds. You want to divide that by 3. That would be 50 ounces of water you should be drinking a day. And you could stagger that throughout the day. Can you drink coffee? Absolutely. Tea? Absolutely. You want your soda? Great. I don't care. Just maintain that amount of water. If you maintain that amount of water, not only will you be healthier, you will lose weight, your body will function at a higher capacity, and you will tend to get sick a lot less, because it would flush out everything else that's in there. Because insulin levels has a lot to do with your way your body fights, and the immune system, and your adrenal glands, as well as your pancreas. So water helps flush all of that out. And by drinking that much water, it's not going to leave a lot of room for a lot of other things that the body doesn't need or wants. All right? So we talked a little bit about, you know, knowledge is power. You know, your doctor should be your coach as well as your doctor. He should help guide you and tell you what you need or what direction you should go to on an individual basis, based on the goals that you have or he sees with health issues. And this should be follow-up. And you have to be an active participant in your own health. When you get sick or you get hurt, who feels it? You do. Who's responsible for taking care of it? The doctor? No, you are. Too many people put the blame on other people when they have an illness or they have a health problem. They're like, this doctor didn't help me, this doctor. What'd you do for yourself? Guess what? Back to that. Your diet, your exercise, you're overweight, you're underweight, you're sleeping too much, you're not eating right, all pertains to who you are and what your body's made of. Your body, you can't keep doing the same thing over and over every day and expect a different result. You need to be making changes and implementing. Now, it's the time to make the changes. You have so much access. What type of diet should I go on, doc? Everybody's an individual. Everybody can be doing a different type of exercise. Most of the exercises work. Most of the exercise machines you see, whether it's the Peloton, I see you here, Michelle, that you've been using and totally turned your lifestyle around. That, along with the Chuck Norris one he has, they all work. They're not to be hung clothes on. They're to be used. If you use them, you will lose the weight. Plus, not only losing the weight, a lot of people do exercise for weight loss, but it's your cardiovascular, which increases your heart rate, increases oxygen flow to the tissues, which makes you healthier. If you smoke, I won't even comment. If you're still smoking with all the warnings that are out there and, the skull and crossbones on the package and everything else, just smoke away from others so they don't get that secondhand smoke. But increasing oxygen and blood to your tissues is what's going to help you heal. Your best defense for coronavirus is a good offense. It may be a little late in the game now, but guess what? There's going to be other viruses out there. There are going to be other colds out there. There's going to be other diseases out there. If you live in Florida and you have a pool of your own that's open, and you get in that pool 15 minutes a day and walk in chest-high water 15 minutes a day every day while you're quarantined, that's equal to 45 minutes to an hour outside of a pool. People say, I could do that. Try it. Try walking at a target heart rate in chest-high water for 15 minutes. That will kick your butt, but it burns 3 times the calories in 1/3 the time. Okay? The gravity is taken away because the water displaces it, so you have no pain in the joints. It works the muscles specifically, and that's why you don't feel any joint pain. So we have a lot of knee patients, hip patients, low back patients that we put on that. And the ones that do it lose the weight, they feel stronger, and they feel better without the pain. The objective here is to do something on a regular basis. And if you do follow 1 or 2 of my instructions, if you do nothing today, but say, you know what, I'm just going to drink 8 glasses of water a day, I'm going to do 64 ounces a day, I guarantee that you'll feel better. I guarantee if you just exercise a half hour a day at target heart rate, not just strolling in the pool with, a floaty, you need to be hitting target heart rate. And those who don't know what target heart rate is, I'm going to tell you right now is another formula. You hear about it, you don't know about it. You take 220 minus your age, then you multiply that times based on the fitness you feel you're at, which is if you feel you're in lousy shape, times 75%. If you feel like you're in good shape, you times it by 80 to 85%. If you're a high-end marathon runner or a competitor, you times it by 90%. That's going to give you a heart or a target rate, say 145. That's how many beats per minute you want your heart rate to be during the whole time, at least minimum of 20 minutes, to get the best aerobic and blood flow and oxygen to the tissue. That's what they talk about target heart rate. You should be doing a minimum of 20 minutes a day. That will what? Increase your immunity. That will make you stronger. That will get you healthier. That will burn fat where all the toxins are. We're not on vacation right now. It's your responsibility. You can't point fingers. Whose responsibility is this virus? Yet to be determined, but it doesn't really matter, right? We just want to avoid getting it We want to avoid getting sick. We want to avoid getting our families and our friends sick. We want to get healthy. We want to get back to our normal lifestyle. But hold on. Let's not get back to your normal lifestyle if you don't exercise, if you eat like crap, if you sleep too much. Let's change that lifestyle. By changing that lifestyle, it will allow you to live longer, to live healthier, to be happier. We're all under stress. I have 3 offices I got to keep running. You know, we're seeing patients right now. We're keeping separation. We've got big facilities. We keep patients far apart from each other. You know, pain doesn't take the weekend off. Pain doesn't take the coronavirus off. People are in pain every day. They get in accidents and falls. We treat them from everything from a pro athlete to the amateur athlete to babies at 6 months old to oldest patients about 102. You know, they still need the care. We want to practice wellness. The better health you're in, and genetics has a lot to do with it. The better health you're in, the longer you're going to live, God willing. The less susceptible you are to colds and flus. The less susceptible you are to heart disease, lung problems, digestive problems. There's plenty of education there. We're available for phone consults and no charge. If people have questions, give us a call. I've been doing this a long time. The thing is, it's up to you to take the responsibility to take care of yourself. Bottom line, you're the one who's going to suffer. You're the one who's going to get sick. You're the one who's going to be the burden. You know, some of it's out of your control. And in a situation like this, yes. You know, and every day, and this is Holy Week for me, being a Catholic and a Christian, you know, there's a lot of praying going on. There's a lot of praying before because of this virus, and a lot of people are sick, and a lot of people, you know, are probably saying, hey, I need to change my lifestyle now. What's going to help me? Yeah, an antibiotic's going to help. Yeah, a cure, but what's going to help you in the long term? Lifestyle change, morality change, visualize where you want to be, set your goals. Without a target, you're never going to hit it. You know, you always have to learn. I'm learning every day, patients we see. We got a 10,000 plus patient base in my office. We've been doing this a long time. You learn from them and you listen to them. If you're not a patient of mine, if you're a colleague I see on here watching me as well, you have to take care of yourself on a daily basis. We're going to do this again at noon on Saturday. Dr. Alessandra Colon is my Palm Beach Gardens doc, my partner over there. She can speak and translate in Spanish. Probably not for this one. But I want to thank you guys. I hope you got a little bit out of this. I hope you do one of 5 things we mentioned to help yourself get healthier, create a lifestyle that you can enjoy and have less worries. You know, there's always going to be crap out there. We want to minimize it. We want to help. I've been doing this and for the virtue, and God has given me the ability to do this with patients. And bottom line, most of the physicians out there, we're here to help you. You got questions, ask us. We'll give you the best information. If we can't find it, we'll point you in the right direction. But you have to take the first step. You have to be the one responsible. So I want to thank you. We'll see you Saturday, probably at the Gardens location at noon. Make sure you wash your hands, shower, do your laundry regularly, and keep your family safe. God bless, and we'll see you Saturday.